This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo. In partnership with the KRMC Foundation and Midwestern University, KRMC is conducting a study to measure community spread of COVID-19 in the Kingman service area. Today, we're talking all about that. My guest is Dr. Anthony Santarelli. He's a clinical research administrator here at KRMC. Dr. Santarelli, thanks so much for joining me. Welcome to the program.
Thank you so much for having me, TG. I really appreciate being able to come on and tell you about the study we have going on here at KRMC and let everyone listening know all about it as well.
Thank you. I want to get into the study. First, I just have a quick question because I have not met you until now. And are you a new guy around here?
So I am a new guy around here. I fell in love with Kingman coming out to visit the area and decided to make it a more permanent move.
Yeah. And so have we had clinical research administrator here at KRMC? Is this a new venture for us?
So I am the first clinical research administrator here at KRMC. Though KRMC is expanding, the W.L. Nugent Cancer Center just hired another clinical research administrator to try and prospectively garner the knowledge needed to best serve our community's needs.
Yeah. Very interesting. Okay. I have a feeling that we're going to have to talk about that more on another occasion, the opportunity for research. I know I've chatted a bit with Dr. Rivera about that as well. And when he came on board, he said, research, clinical trials. Anyway, there are so many things that are worth exploring. So we will return to that another time.
Absolutely.
To return to this, to talk about this COVID-19 antibody study. So I'm interested. We're going to get into the details of that. My first question is, why this study? What are you hoping to find?
Well, the study itself has three particular aims. But by and far, the most important thing that we're trying to determine with this study is what was the prevalence of COVID-19 throughout our community. And we're going to do that by testing antibodies. That's going to detect whether or not you've had the virus that causes COVID-19, SARS-CoV-2, and approximate how long ago you may have had it, whether you knew about it or you were what we call an asymptomatic carrier. Our second point in the study that we hope to find out is whether or not people who have contracted COVID-19 then maintain levels of antibodies over a period of time, providing light to whether our community maintains a high antibody load and whether or not that is either protective or non-protective for future reinfections of the virus.
This has been such a difficult time in terms of healthcare, in terms of our economy. We're all missing out on the things that we love, our old world that we had that wasn't that long ago, right? But as a research scientist, this must be just a fascinating time for you.
There's so many new ways to look at how people behave and to learn about our world during unprecedented times, that it really is a unique experience for the entire scientific community in a way that we haven't had since the 1918 flu epidemic.
It's so interesting. You will probably have tons of adventures in your career as a research scientist. You're a younger guy, right? But this may be singular in its weirdness. Fair to say?
That is fair to say. Though coronaviruses, like COVID-19, recur over time, none has kind of had this broad impact as the particular pandemic we're going through now.
So talking about the study that you're working on, I was reading the press release and it says the data are helpful when determining policies and other measures to prevent the spread of illness in our area. So policies and other measures, that makes me wonder, whatever you uncover, how might some of that information be used?
Well, when we think about how information is used to determine policy, I really find it helpful to look at it in three ways. From the governmental side of things, from our local businesses side of things, and from providing healthcare. For providing healthcare, a lot goes into allocating resources, whether they be physicians on staff, nurses available, on the less severe end. However, on the more severe end, it's whether or not patients need to go to an ICU bed, how many ICU beds we have available. And then how can patients coming into the hospital system be triaged most effectively to allocate those resources? On the businesses side of things, we're all wearing masks now. We're all sanitizing our hands. We all have social distancing measures in place in each one of our local restaurants, stores, and community spaces. How effective those have been at reducing the spread in our community is unknown until we have the data on the actual spread of our community. Policies that are put in place in terms of spacing at local businesses, limitations on community gathering sizes, are all informed by the underlying data of how far and wide this illness has spread. By garnering these data, we then have the tools needed to make the best decisions for the health and well-being of our community.
Well, Dr. Santarelli, when you and I discussed doing this radio program, I thought it would be a great opportunity to produce some experiential radio, so I volunteered myself to be a test subject. What can volunteers look forward to? What do they need to know about this study?
Well, the first thing that volunteers need to know about the study is that our ability to know the impact that COVID-19 has had on our community and how well our community has done at fighting the epidemic here is limited by the number of participants we actually have. Mm-hmm. So first and foremost, please, if you feel inclined, come down to KRMC and participate. When you arrive, you're going to be greeted with probably my smiling face, but if not me directly, one of the research assistants helping with this study. And these are your local healthcare providers through collaborative work with the KRMC Outpatient Lab, the KRMC Emergency Medicine Department, and many other departments throughout the hospital system. When you show up, you'll be greeted by me, or not me, one of the research assistants, and we will give you, first thing we're going to do is scan your head to make sure you're not currently exhibiting any of the symptoms of COVID-19.
No fever.
That's for the safety of our community. Mm-hmm. If you are sick, I would like to stress, please contact your healthcare provider for appropriate treatment. But when you come in, you're going to walk into our outpatient lab, greeted with our smiling face, and we're going to go over an informed consent form. There, I'll tell you all about the study, what we hope to learn from it, what your risks are for participating, and what the benefits to our community that study is. Mm-hmm. You're free to ask any questions that you might have when we're talking about it, and you're free to choose then and there whether or not you want to participate further than coming down to KRMC. Then, once you give your informed consent to participate in the study, you'll be escorted over to our outpatient lab where one of the phlebotomists there will draw a small sample of blood. We're going to use your blood to test antibodies. And then you'll come over, meet up with the research team once again, and we're going to be giving you a relatively simple questionnaire that consists of 3 parts to understand your health concerns, your health behaviors, and where risk for COVID-19 in our community may be most high or least high.
There will be a blood draw. Will the volunteer participant find out later the results of the draw?
Absolutely. Once you get your blood drawn, the results of your blood draw will show up on your KRMC patient portal. And if it's a positive, someone from the research team is actually going to approach you for a follow-up, tell you about the ongoing status of the study, and inform you of best treatment practices to deal with the illness that you may have gotten over. If it's a negative, someone will still follow up with you to give you information about the study.
You're looking for antibodies against the COVID-19 virus. And I'm wondering what the antibodies mean. So if we discover that I have antibodies, what does that mean for me in a practical sense? And I ask that because I'm wondering, do we know about what that suggests in terms of further immunity?
Right now, the science on how the virus that causes COVID-19, SARS-CoV-2, works within your immune system is still largely out. Right now, in terms of immunity, we cannot give a definitive answer, yes or no. Studies like this need to be done before we can provide those answers. In brief, I can tell you that though the evidence suggests some degree of immune function may be altered after infection of COVID-19, immunity is not guaranteed.
That's a good answer. And maybe this is a little more into that science, but I'm wondering, we know that there are several different kinds of coronavirus, correct?
Correct.
Does having an antibody of one suggest any sort of protection against the other viruses? You know what I'm asking?
So to answer that question, we're going to delve a little bit deeper into the science.
I think I can do it.
Talk a little bit first about what a virus exactly is.
Okay.
A virus consists of genetic material. While you and I have DNA, viruses largely have their genetic material comprised of RNA, which is a single-stranded form of all of these nucleic acids. Around that RNA are a series of proteins that provide an envelope for that RNA as it's out throughout your bloodstream, not interacting with your cells. And then on the outside of that membrane are a number of different other proteins.
Okay.
This specific illness, and many coronaviruses like it, have a limited number of external facing proteins. But the one of real importance is, or the one in the literature right now receiving the most focus, is the spike protein. This, if you remember your small image of coronavirus, those green blobs facing outside of that red ball of...
Sure, yeah.
Yep. These bind, and they actually bind to your cells and inject and allow the virus to inject its genetic material into your cells.
Okay.
Once it's there, that genetic material is translated, transcribed into more proteins, more viruses are made in that cell, and then ejected outwards. So antibodies themselves are designed to target and bind to different proteins, the spike protein being one of them.
Okay.
There are two different kinds of antibodies that we should really talk about. The first one, and possibly the most prominent, are neutralizing antibodies. Now, neutralizing antibodies are relatively large compared to a virus. And what they do is they get in the way and they block that spike protein from binding to your cells and allowing the virus to enter and lead to replication of SARS-CoV-2. Mm-hmm. The other one are targeting antibodies. These inform your immune system to produce more antibodies or eliminate cells that become infected. While neutralizing antibody levels are detected after an infection with COVID, the evidence now suggests that they diminish over time.
Okay.
Indicating that the chances of you being protected from reinfection by neutralizing antibodies is only limited.
Yeah, right. Got it.
However, your T cells and B cells, your immune system, has a memory of producing more antibodies if it detects the presence of an illness again. That memory seems to persist for a longer period of time, but that's only gets kicked into gear once you become reinfected.
So, yeah, if you have the antibodies, they could help.
Having antibodies to the SARS-CoV-2 virus is your body's natural mechanism to protect yourself in the future.
Yeah.
We don't know whether or not our bodies are able to protect ourselves in the future yet for this specific virus.
If you'd like to enroll in the study to help understand the spread of COVID-19 and the prevalence of antibodies in our community, contact KRMC Outpatient Scheduling at 928-692-2727. That's 692-2727, and choose option 4. All who take part in the study will be entered in a drawing to win a new iPad from KRMC. And if you're going to participate, get to it, because the dates of this study are September 28th through October 9th. When we return, I'll offer up some blood for the good of science, and we'll see if I have the antibodies for COVID-19. Stick around. Welcome back to Focus on Your Health. I'm TG LaFredo, and this week on the program, my guest is Anthony Santarelli, PhD. He's a clinical research administrator at KRMC, and he's conducting a study to measure the spread of COVID-19 in the Kingman service area. Now, for this study, you are looking for participants from the Kingman area. What does that mean in particular?
So we are looking for participants from the Kingman area. That includes New Kingman Butler, Golden Valley, Valley Vista, Peach Springs, Dolan Springs, Meadview, Chloride, Valentine, Wickiup, Yucca, Hackberry, Peoples of the Halapai Tribe, and Oatman.
Is there an age range that you're looking for in participants?
We would like adult participants, 18 years and older, to come in to help assist us with the study. If you're old enough to vote, you're old enough to participate in the study.
Okay. And you're looking for people who are healthy at this time, as you alluded to.
Currently healthy. If you have had symptoms of COVID-19, in the past, you are also welcome to participate.
And if you've been healthy for the last 6 or 7 months,
you are welcome to participate.
Because ultimately you want that as well, because you're talking about asymptomatic spread.
So exactly. We need to know the number of people in our community that have been infected and how many of those do develop respiratory symptoms. So this allows us to know how far it's gone, what proportion of people here get sick, and then what proportion of those people who get sick end up in the hospital.
That will be very interesting because it seems like some people will find out, oh, you have these antibodies, and they had no idea they were, right? I mean, it seems like this will happen.
We expect there to be a lot of antibody positives for people who never experienced symptoms.
Yeah.
You may never have got sick. However, the antibody is capable of replicating within your body and then shedding viral particles to those around you.
By the way, Doc, thank you for helping me with the science. I was not...
You're doing great.
When does this study officially begin? The
study officially begins September 28th.
Okay.
At the KRMC outpatient lab.
And do you have a closing date?
We do have a closing date. So closing for phase 1 of the study is October 9th. Total closing of the study is December 11th.
What happens after phase 1?
So after phase 1, if you do test positive for antibodies to SARS-CoV-2, you're going to be contacted by one member of the research team and will request your participation in a retest at a future time point between November 30th and December 11th. This will let us know how much your antibody levels have either increased, decreased, stay the same, and whether or not you've gotten reinfected after you've already tested positive for the antibodies.
Interesting. How do false positives, false negatives, how do they play into this whole thing? Do they? Are they a factor?
They do play into it. Antibody testing as a whole works on the principle that you bind to a specific protein. Though you're not binding to the whole protein, you're binding to what's called an epitope of that protein,
okay,
or a small portion of that protein that can be present in many different places, bodily systems, different viruses. So false positives creep up whenever you have non-specific binding or non-specific production of the SARS-CoV-2 antibody.
Okay.
Luckily, the false positive rate of these antibody tests is relatively low, but they are being accounted for in the study by the number of participants we're asking for from the community.
You anticipated my next question. How many participants are you hoping to get?
We are hoping to get 3,000 participants from the greater Kingman area.
Would it be possible to have too many participants?
It would not be possible to have too many participants.
You want as many numbers as you can get.
As many as we can get to enroll in the study, the better estimate we have of how many people in our community have contracted that.
Right. And I have a note, sorry to talk over top of you there, Doc. I have a note that KRMC is sweetening the deal. We're trying to encourage people to come out and take part in the survey. And all who participate, if they so choose, can be registered to win an iPad. So there's a little something. Okay, so it's time to begin the next phase of our radio adventure. I have people waiting for me over in the KRMC lab. All right, here we go. I went over to the main campus, filled out a short form.
Riss will call you back in just a moment.
And in a moment, I was in for my blood draw. All right, so here we are. We're at the lab. We're masked up, and I'm with Marissa. Hi, Marissa.
Hello. How are you?
I'm great. You were just telling me how excited you are to be on the radio.
Very excited.
Okay, so what are we going to do here?
We're going to be drawing your blood, just taking one tube, which is probably a spoonful of blood.
How long do you expect that to take?
Probably a day.
I like you, Marissa.
It shouldn't take too long. We run it here, so the results should come back pretty quick.
How long will it take to actually extract that much blood from me?
Oh, just a couple minutes.
Are you prepared to help me through it if I cry?
Yes, I will take good care of you here. And that is it. I'll get you wrapped up. Just leave this bandage on about 10 to 15 minutes to stop the bleeding. And you'll be all set. Did you have any questions or concerns?
I think I'm all set. Thank you so much.
You're very welcome. Thank you for choosing KRMC.
At this point, I should mention that we decided against sharing the questionnaire on the radio for fear that doing so could cause bias among other participants. But I will tell you, it's fast, it's easy, it's really no problem. Since March, I have been even more reclusive than usual. And the times that I do go out, I always wear a mask and I use copious quantities of hand sanitizer. I have not been sick, and I'll be surprised if I find out that I have the antibodies for COVID-19. But who knows? Let's check the results. All right, it's a couple of days later, and joining me this time on the phone is Dr. Santarelli. Hey, Doc, how are you?
I'm doing fantastic, TG. I heard you got your results back. Are you ready to go over them?
I am. I'm at my patient portal on the KRMC website, and I am looking at my health record, and here's a tab that says results. So let's check this out. There's my test September 9th at 4:01 p.m., the antibody test. I'm going to click on this, and it says non-reactive. So what does that mean?
So all of these antibody tests work on a principle of what's called an ELISA or analysis, and those are enzyme-linked immunoabsorbance assays.
Okay.
Essentially, you can think of it like Velcro.
Okay.
On one side of this assay, what you have are antibodies that are going to bind the SARS-CoV-2 antibodies in your system. If those end up binding to this ELISA, then we can detect the presence of those antibodies. If you don't have any, you'll have no reactivity.
Okay.
So you have essentially one layer of Velcro down and nothing sticking to it.
Okay, I like that. That's a good visual analogy. Is this a guarantee that I did not have COVID-19?
So no, this is not a guarantee that you did not have COVID-19. All this is telling you that you currently do not have any antibodies for COVID-19.
Okay.
Now, there are false positives and false negatives in these tests. However, that percentage is relatively low, so this can be considered an accurate test. Now, what I want to point out to you, though, is though it may say non-reactive, the current evidence in the literature now is that these antibodies decrease over a period of time.
Okay.
So you may, in fact, have been infected with the SARS-CoV-2 virus, but your antibody levels now have just dropped below the detection limit of the test.
So how does my data help contribute to the overall picture of what's happening in the community?
Well, TG, the community is made up of a lot of individual small snapshots, just like the data you see on your screen right now.
Mm-hmm.
Well, you might be non-reactive. There are people out in the community who are going to turn up positive for this antibody test. And when we compare how many people have come and participated in our study, the rates of positive results to negative results, we can start to understand through what groups of people this illness has spread throughout our community.
Dr. Santarelli, thank you so much for a great conversation and a really interesting look into research and kind of what's going on here in the community. I want to ask, when you get the results, when you conclude your survey, will you check back with us?
We will check back with you. We'll let you know what the status of the study is, some of the things that we're finding, and what kind of information is gained from it to help out everyone here in the community.
If you'd like to enroll in this study to understand the spread of COVID-19 and the prevalence of antibodies in our community, contact KRMC Outpatient Scheduling at 928-692-2727. That's 692-2727, and choose option 4. Again, we are looking for participants from the Kingman area, and that means New Kingman Butler, Golden Valley, Valley Vista, Peach Springs, Dolan Springs, Meadview, Chloride, Valentine, Wickiup, Yucca, Hackberry, Oatman, and members of the Wallapai tribe. The dates of this study are September 28th through October 9th, so it's a limited time, and all those who enroll will be entered in a drawing to win a new iPad. And that is the show. That's Focus on Your Health. This week's program took a bit of arranging, so I'd like to thank all those who made it possible. Terry Williams and Sean De La Riva in KRMC Public Relations, Valerie McMillan, Dr. Ryan Swap, Carrie Herbine, Heidi Anderson, Marissa Verdejo, and the good folks at the KRMC Lab, and of course, Dr. Anthony Santarelli. And thank you for listening. I'm TG LaFredo. We'll catch you next time.